be that students, no matter whether they're hopefully in person, and that should be absolutely the goal, for students to be able to be in person in school, but if whatever the circumstances dictate, require some distance for a while, if there's a flare-up of the virus in that particular school or in that classroom, that there are plans in place to be able to shift to immediately, and that can be done seamlessly. I've also heard of a lot of thinking going into how to minimize the risk of students being together in the fall, and thinking about things like, where do you have choir and where do you have band? And I have heard a lot of discussion about thinking anew about learning outside as long as the weather is good, and putting up little temporary coverings or tents to be able to hold your choir classes or your band classes outdoors, where you have a lot more fresh air. And I know the medical folks among us would probably say that's a good idea. But thinking about those sorts of situations in ways that are unique to your particular school or your particular community is an imperative for all of us.
Thank you. That was so well said. And I think part of the reason for this dialogue today was to really look past and within the first dimension of where we exist in COVID-19, but to bring together those other dimensions, not only the physical, specific health around COVID-19, but the emotional and mental, intellectual health. And I think, Mr. Secretary, you talked about that at the beginning, and we have brilliant people here sharing with us, and we'll be in that third panel. But how are you tackling kind of the risk-benefit relationships of all of these different factors? And is there a way that we can bring not only a whole of government, but a whole of thought process on the three dimensions of a child and what they need, rather than the unidimensional piece of COVID-19? And how are you thinking about that?
Well, and I think we see this not just in the school context with kids, but just generally, as we talked about work or healthcare. In the healthcare setting, I've been trying to make it clear that too often we're talking about health versus reopening the economy. It's a balance between, are we going to have economic activity and healthcare, where I actually think it's health versus health. And so we're seeing kids not getting pediatric vaccinations. Millions of children are not getting pediatric vaccinations. People are not getting preventive screenings. They're not getting diagnosed for cancer. Hundreds of thousands of people are not getting diagnosed with cancer. People are literally not presenting in emergency rooms with stroke and heart attack. They didn't stop having strokes and heart attack. They're not presenting in the ER, where time is muscle and time is brain, and they need to get in. And the long-term, very real health consequences for adults and children of being locked down in your home are going to be with us for some time. And then you add the mental health issues for the kids. Children are social beings. We're all social beings, and we need to have that interaction. And we already have enough of denial of that through social media and everything else, and then we take away the physical side of it at school and those fora. And I think any one of us in this room can see in our own children the impact it has on them. In some respects, we're lucky being essential and having to go to work. We don't actually get to and have to feel all of that personally. That experience. It's important that we deal with the disease. Dr. Birx can talk more about, why we did the initial slow the spread. But that was because of a need to flatten and delay the curve of disease while we built up tools, health system, personal protective equipment, advanced on therapeutics and vaccines, learned how to deal with this disease. But now we have tools where we can manage through if we act responsibly. Acting responsibly, by the way, does not mean going to a very, very crowded bar in an outbreak area without facial covering. That would not be good individual responsibility. If we act with good individual responsibility, protecting ourselves, protecting those in our households, and protecting those that we interact with in normal society, there's no reason we can't do any of this. We have healthcare settings. We have